So if someone is experiencing genital itchiness, it's not every time that this person, has fungal infections or sexually transmitted infections. So imagine if someone is telling you that they've always been condomizing when having sexual intercourse, and it so happens that each time they condomize, they will start experiencing genital itchiness, excessive genital itchiness, sometimes even swelling or skin discoloration. So in that case, you can think of a certain condition called latex allergy. So latex allergy is a hypersensitivity condition where someone is allergic to latex rubber, which is also called polyurethane. Okay, so this latex rubber or polyurethane is made from a certain protein which is extracted from a tree which is called a rubber tree or Heve brasiliensis. Now, what happens is that so this same latex rubber is the material used to make condoms. It is the material used to make the gloves we use in the hospital, the catheters, even the balloons that people use for events. Yeah. So what happens is that in a few individuals, okay, especially those individuals who have history of allergies, okay, those people with histories of allergies. So what happens that in these individuals, their immune cells, they consider this protein to be foreign. So what they do is that they produce antibodies which are called IgE antibodies against this protein, and these IgE antibodies, they bind to a certain immune cell which is called the mast cell to release a chemical which is called histamine, which causes these allergic reactions. So you find that in some people, those allergic reactions can just be local. Okay, they can just cause local itchiness, swelling, reddish skin discoloration, local heat on the area where someone has come in contact with this latex rubber. Okay, and then what happens is that in these individuals who have latex allergy, they can also have a certain condition called latex fruit syndrome, where they can have a cross reaction to certain proteins which are similar to that protein. So if these people consume fruits such as bananas, pawpaw, avocado, they can also react. Okay, and sometimes the symptoms can be systemic. Okay, where someone can even have rhinorrhea, which is the running nose. They can have difficulties in breathing because the airway narrows. Okay, which is called as bronchospasms, and they can have swelling of lips, swelling of the throat. They can have a racing heartbeat. Okay, then they can even have low BP. So this is about this. That's all I can share about latex allergy. And if someone discovers that they have latex allergy, they have to avoid contact from these materials. If you work in a hospital, you can use gloves that are made from vinyl or nitrile. So each time you're using gloves, you have to read if they are made from latex or these other materials. Then if someone comes to a hospital, they can be given, if they have systemic symptoms, it depends with how they come. Okay, if they have systemic symptoms, they have what is called anaphylactic shock. They can be given adrenaline, hydrocortisone, even some IV antihistamines. Thank you very much for watching.